Welcome back, everyone, to another deep dive here on the Deep Dive. You know how this works. We take a bunch of interesting information and try to make sense of it for you.
Yeah, we try to kind of distill it down, give you the important stuff.
Yeah, and today we're looking at medications.
A big topic, lots to cover here.
Huge, yeah, and we've got information here about different types, what they do, how they're used.
Yeah, how they're used, when they're used, who they're used for, and how much of them you would use.
Dosages, yeah. So I think that's a really key thing for people is, we all hear these medications, but it's hard to kind of visualize like, okay, what does that actually mean? What does that mean for a doctor or a patient?
Right. Dosage is so important.
Yeah. So to kind of break this down, we're going to look at a bunch of different categories. We've got emergency contraception.
Okay.
We've got medications used for opioid use.
Right.
We've got medications for alcohol dependence. And then we've got two kind of classic classes of antidepressants, SSRIs and TCAs.
All right. Sounds like a plan.
So
yeah.
Emergency contraception first.
Okay.
So we've got dithylstilbestrol.
DES, yeah.
DES, yeah. Now, the primary use we have listed here is for emergency contraception.
That's right.
The dosage is 15 milligrams twice a day for 5 days, starting within 48 hours of the incident.
Got it. Yeah. And just to clarify, that's the only thing that we have for DES as far as information.
Right.
So we don't have anything about how it would be used for infants, adolescents, adults, or the elderly.
Got it.
In any other context other than this specific dosage for emergency contraception.
Right. And it doesn't say anything about other similar medications for that.
Exactly.
All right. So next we have norgestrel at 0.5 milligrams and ethinyl-estradiol at 0.05 milligrams, which is sold as Overal.
Yep.
For emergency contraception, the dosage is 2 tablets within 72 hours of the incident.
Okay.
And again, same as before. It's just we don't have other uses or other dosages listed.
Yeah.
Okay. Now we have norgestrel at 3 milligrams and ethinyl-estradiol at 0.03 milligrams, which is sold as Luvril. And this one is a little different. 4 tablets within 72 hours, followed by another 4 tablets 12 hours later.
Okay. 2 doses, essentially.
Yeah.
Okay.
So that's the Luvril regimen, and same as the others. No other uses, no other dosages for different situations.
Got it. So pretty specific.
Yeah. All right, so let's move on to some medications that are used in opioid use.
Okay.
So we've got naloxone, which is Narcan.
Right.
And the primary use here is opioid partial agonist, and then most importantly, antidote for opioid overdose.
Yeah, so we're not really given any sort of specific dosage information here. I mean, I think the focus is really just on that antidote in the case of overdose, which is, a really important role.
Yep.
I mean, there are other opioid antagonists, but the information we have doesn't really specify any of those when we're talking about emergency overdose reversal. It's kind of, naloxone is just, I guess it's the one to go to.
Yeah.
It's the key that fits in the lock, essentially.
Right.
Blocks that receptor.
Okay. And then we have buprenorphine, also known as Buprenex.
Right.
And this one's kind of interesting because it's both an opioid partial agonist and an opioid antagonist.
Yeah, it kind of does both.
It's like, yeah, it does both.
Yeah.
So it's used to decrease heroin craving and opiate use. Again, no specific dosage information for different ages or populations.
Yeah, that one's tricky because it can activate the receptors, but it doesn't activate them as strongly as a full agonist like heroin or morphine or methadone.
Okay.
So it can kind of satisfy some of that craving without producing that same, euphoric effect.
Got it.
Yeah, so it's like the middle ground,
Yeah.
so it helps people.
Okay. Then we have buprenorphine and naloxone, which is Suboxone.
Oh, together.
Together, yes.
Yeah.
So this one is a narcotic analgesic, opioid agonist, and opioid antagonist.
It's got it all.
It does it all. It treats opioid dependence.
Okay.
And requires specific qualifications to prescribe.
Right. And that makes sense because of the, the potential for abuse.
Right.
Yeah, so they want to make sure it gets in the right hands.
Yeah, and no dosage information,
Yeah.
again, for different groups.
Right, yeah, and that combination there is pretty clever, actually, because the buprenorphine, that's the one that kind of helps with cravings and withdrawal.
Okay.
But the naloxone is there to kind of prevent misuse. So if somebody were to, let's say, try and inject Suboxone, the naloxone would kick in and block the opioid effects.
Interesting.
Yeah.
So it's kind of like a fail-safe almost.
Yeah.
Okay.
It's a deterrent.
Got it. That's a better word.
Deterrent, yeah. Okay, methadone, also known as dolafine.
Yeah.
So this is a narcotic analgesic, and it suppresses opioid withdrawal symptoms.
Yeah. It's used for detoxification and maintenance within FDA-approved programs.
Got it. So heavily regulated medication there.
Yeah.
You know?
Yeah. And no specific dosage, again, for different populations.
Right. And that makes sense. Methadone is it's a long-acting full opioid agonist.
Okay.
So it fully activates those receptors, just like heroin or fentanyl or any of the more powerful opioids would.
Got it. All right. So we've got nalmefene, also known as Revex.
Okay.
This is an opioid antagonist. It increases abstinence and decreases the history of drinking days.
Okay.
And no specific dosage information again.
So wait, no. So this is an opioid antagonist, but it's actually used to help with alcohol, to reduce alcohol use?
Yeah.
Oh, that's interesting.
Yeah, it's a little, it's interesting. Yeah, and it doesn't explain, why that is.
That's so wild. I mean, it really makes you think about how interconnected those systems are. Like
Yeah.
the opioid system and alcohol.
Right. Okay, so then we have naltrexone extended release injectable.
Okay.
That's Revia or Vivitrol.
Yep.
So this is an opioid antagonist. It increases abstinence, decreases the history of drinking days, and assists with cravings.
So very similar to, what was that?
Nalmefene?
Nalmefene, yeah.
Okay.
And again, no specific dosage.
Right. Right. No dosage information.
Yeah.
And but there's, obviously the oral form as well.
Yeah.
But here we're focusing on the injectable extended release form.
Yeah.
Okay.
All right, so then we've got some medications specifically for alcohol dependence.
Okay, cool.
So we've got camprosate, also known as Camprol. It's homotaurine.
Okay.
It increases abstinence through decreased craving.
Got it.
And it's thought to alter the development of tolerance.
So kind of nipping it in the bud.
Yeah. And no specific dosage information.
Right.
For different groups.
Okay.
And then we have ondansetron, also known as Zofran.
Oh, yeah, I've heard of that one. This one's a selective inhibitor of serotonin, specifically 5-HT3.
Okay.
It increases abstinence and decreases craving.
Okay.
And again, no specific dosage information.
Right, right. So I think this one's really interesting because a lot of people might know it for, it's an antiemetic.
Yeah.
So it helps with nausea and vomiting. But in this case, we're talking about, it's being used to treat alcohol dependence.
Right. Kind of an off-label use.
Yeah.
Yeah.
But it just goes to show, I guess, that, a drug can be helpful for a whole range of conditions, not just what it's originally approved for.
Right. Yeah.
Yeah.
Okay. So moving on to antidepressants, we're going to start with SSRIs.
SSRIs, yeah. Selective serotonin reuptake inhibitors. So these are really common. A lot of people know about SSRIs. And they basically work by increasing serotonin in the central nervous system.
Right.
They block its reuptake.
Got it.
So more serotonin is available.
Okay. So first we have citalopram, which is Celexa. And the dosage here is 20 to 60 milligrams per day for adults.
Okay.
Just a tablet form.
Right.
And we don't have any specific dosages for infants, adolescents, or the elderly.
Okay.
The side effects are sedation, sexual dysfunction, agitation, yawning, gastrointestinal issues, and weight gain.
That's a lot of side effects.
Yeah. And it says that other SSRIs kind of work the same way.
Right. So, I mean, they all increase serotonin, but they might have slightly different, side effects.
Yeah.
So it's important to, work with your doctor to find the right one.
Right. Next is escitalopram, also known as Lexapro.
Yep.
The dosage here is 10 to 20 milligrams per day for adults.
Okay.
It's also a tablet.
Got it.
No specific dosage for the other age groups.
Right.
Side effects: somnolence, headache, sexual dysfunction, and gastrointestinal issues.
Okay.
It also mentions that it's an enantiomer of citalopram.
Oh, that's interesting.
So basically it's the same molecule but kind of mirrored.
Yeah, it's like they're looking in the mirror at each other.
Yeah.
So it can change how the molecule actually interacts with your body.
Yeah. Okay. Next is fluoxetine, also known as Prozac.
Prozac, yeah.
This comes in capsule, tablet, and liquid.
Okay.
It has a long half-life.
Oh, right. So that means it stays in the body longer.
Yes.
Okay.
We don't have a specific dosage for this one.
Got it.
Side effects are insomnia, headache, gastrointestinal issues, and sexual dysfunction.
Okay.
So yeah, long half-life means that it takes longer to reach a steady level in the body, but it also means that it takes longer to clear out.
Right.
So if you need to switch or if you have side effects, it's going to take a while.
Okay.
Next, we have fluvoxamine, also known as Luvox.
Okay.
This one is 100 to 300 milligrams per day in adults. It's a tablet.
All right.
No specific dosages for other age groups.
Okay.
This one has a black box warning
Oh, okay.
for liver toxicity.
Right. So that's serious stuff.
Yeah.
You know, that's the strongest warning that the FDA can issue. So important to keep that in mind.
Yeah, and side effects. Sedation, sexual dysfunction, agitation, and gastrointestinal issues.
Okay.
Next, paroxetine, also known as Paxil, or CR Paxeva.
Oh.
This is 50 to 200 milligrams per day for adults.
All right.
It's a tablet. No other dosages listed for the other age groups.
Okay.
This one has some warnings.
Okay.
It's teratogenic.
Okay, so that means it can cause harm to a developing fetus.
Right. And significant discontinuation syndrome.
Okay.
So you have to be careful if you're pregnant or planning to become pregnant, and you have to be careful about, how you stop this medication.
Right, don't go cold turkey.
Yeah. And side effects.
Uh-huh.
Headache, gastrointestinal issues, and sexual dysfunction.
Okay.
And then sertraline, which is Zoloft.
Yep.
50 to 200 milligrams per day for adults.
Okay.
It's a tablet. No other dosages listed for the other age groups. And this one also has the warnings for teratogenic and significant discontinuation syndrome
Got it.
and side effects. Sexual dysfunction, gastrointestinal issues, somnolence, and headache.
Okay.
And it also mentions that there are other SSRIs out there, but they all basically function, in that similar way.
Yeah, that makes sense.
Okay, so now we're moving into our final category,
Okay.
which is the TCAs, tricyclic antidepressants.
TCAs, yeah.
So these are considered a second-line treatment for major depressive disorder.
Okay.
They're considered dirty.
Dirty. Okay.
They have anticholinergic effects, antiadrenergic effects, antihistaminergic effects, and potential for EKG changes and dysrhythmias.
So they work on a lot of different systems in the brain and the body.
Yeah.
Okay.
There's a risk of hypomania,
Okay.
and some important warnings here.
Right.
They should not be used with suicidality.
Okay.
1 week supply can be lethal,
Oh, wow.
and they should not be used with MAOIs, which is another type of antidepressant.
Right.
That can be a lethal interaction.
Got it.
And
Yeah.
caution should be used when combining them with SSRIs,
Okay.
because that can increase the TCA levels.
Got it.
So, a lot of warnings.
Yeah, it sounds like you really have to be careful with those. Work with your doctor.
Yeah. So we have amitriptyline, which is Elidil.
Mm-hmm.
This is 50 to 300 milligrams per day for adults.
Right.
It's a tablet.
Okay.
No other dosages listed for the other age groups.
Right.
And it's also used for chronic pain, insomnia, sciatica, fibromyalgia, trigeminal neuralgia, and diabetic neuropathy.
So a lot of different uses there.
Yeah. So it's not just for depression.
It really highlights how versatile some of these medications are,
Right.
It must be working on some pretty fundamental pathways in the body.
Right. Okay, and then we have clomipramine, also known as anafranil.
Okay.
This is 100 to 250 milligrams per day for adults.
All right.
It's a capsule. No specific dosages for other age groups.
Yes.
And the maximum dose is 250 milligrams per day
Okay.
because it increases seizure risk.
Got it.
And this is also used for OCD, obsessive compulsive disorder.
Oh, okay.
So that's another one with kind of multiple uses.
It seems like a lot of these TCAs are being used for different things.
Yeah.
Interesting.
Yeah, and it doesn't necessarily explain exactly how they work, for those different indications, but
Well, I guess we're starting to see some patterns here.
right.
Like maybe with clomipramine being used for OCD, that might suggest it has a bit more of a focus on the serotonin system compared to some other TCAs because, serotonin is thought to be involved in OCD.
Okay.
Yeah, so even though they're messy, these TCAs, we're starting to see some hints about why they might be helpful for different things.
Right. Okay. Desipramine, also known as norpramine.
Mm-hmm.
This is 100 to 300 milligrams per day in adults. It comes in capsule and tablet form. And again, no specific dosages for other age groups.
Got it.
It's also used for ADHD, attention deficit hyperactivity disorder.
Oh, interesting.
So yeah, another kind of multiple use drug there.
So this is actually kind of reminding me, when we were talking about the SSRIs, I think it was fluoxetine, that one with the long half-life. That can also be prescribed for for ADHD sometimes.
Oh, okay.
Yeah, so that there seems to be this crossover, in terms of treatment approaches for different conditions, which I guess makes sense because, the brain's a pretty complex place, and
Yeah.
these different conditions, they can have overlapping symptoms and maybe overlapping, neurotransmitter imbalances.
Right.
Yeah.
Okay. Doxepin, also known as Sinequan.
Mm-hmm.
This is 100 to 300 milligrams per day in adults.
Right.
It's a liquid or capsule.
Okay.
Again, no specific dosages for other age groups.
Got it.
And this one is also used for insomnia.
Oh.
So multiple uses.
It's like they're multitaskers, these meds.
Right.
They've got their primary job, but then they can also pitch in and help with other things.
Yeah.
Interesting.
All right. Imipramine, also known as tofrenol.
Okay.
This is 100 to 300 milligrams per day in adults.
Right.
And this one can be given IM, intramuscularly, or you can take a capsule or tablet.
Okay.
No specific dosages for the other age groups.
Got it.
And this is also used for enuresis,
Enuresis.
bedwetting,
Oh, okay.
and separation anxiety.
Okay.
So this is one where we actually have a use, in kids.
Right. But I guess it's probably used with extra caution in children just because, these TCAs do have those potential side effects on the heart and stuff.
Right. Yeah.
So I'd imagine they're not, prescribing it willy-nilly for every kid who has a little bit of bedwetting.
Right.
Yeah.
Nortriptyline, also known as Pamelor.
Okay.
This is 50 to 150 milligrams per day for adults.
Right.
It's a capsule or a liquid.
Okay.
Again, no specific dosage for the other age groups.
Yeah.
And this one's also used for enuresis and ADHD.
Okay, so some overlap there with the previous one.
Yeah.
But it's interesting. I'm noticing that a lot of these, like amitriptyline, clomipramine, doxepin, imipramine, now this one, nortriptyline, they all seem to fall within this 100 to 300 milligram per day range for adults.
Yeah, there's definitely some similarities in the dosages.
Yeah, I guess that makes sense. They are all in this TCA family.
Right.
But still, always important to follow your doctor's instructions. Don't just assume that if one TCA is in that range, then they all are.
Right, yeah. Always consult a professional.
Exactly.
Okay. Protriptyline, which is Vivactyl.
Mm-hmm.
This is 15 to 60 milligrams per day in adults.
Okay.
It's a tablet.
Yeah.
No other dosages listed for the other groups.
Got it.
And then our last one for this category is trimipramine, which is Sermontil.
Okay.
This is 100 to 300 milligrams per day in adults.
Right.
It's a capsule.
Okay.
No other dosages listed for the other age groups.
Okay.
And similar to the SSRIs, it says that there are other TCAs out there,
Right. Makes sense.
but they all function basically the same way.
Okay. So kind of a big family of TCAs with some variations.
Yeah.
Got it.
So, wow, that was a lot of information.
Yeah.
We covered everything from emergency contraception to opioid-related drugs, alcohol dependence medications,
Yeah.
SSRIs, and TCAs.
It's pretty amazing the range of medications we have to help with all sorts of different conditions.
It is, yeah. It's a little overwhelming, though.
It can be. It can be a lot to take in, especially when you start getting into all the details about how they work and the dosages and the side effects.
Yeah, and I think that's an important point because we've, given an overview, discussed some of the uses and some of the adult dosages where we had that information. But this is just a starting point.
Yeah.
I mean, there's a lot more detailed prescribing information out there.
Absolutely. This is not a substitute for, talking to your doctor or a pharmacist.
Right.
They're the experts.
Yeah, and I think a few things that I found really interesting were how some of these medications are used for things that you wouldn't necessarily think they would be used for.
Oh, yeah. Like what?
Well, we talked about nalmefene and naltrexone and how those are actually, used to treat alcohol dependence, even though they're opioid antagonists.
Right.
Or, amitriptyline, which is an antidepressant, can also be used for a bunch of different things.
Yeah. Yeah, that was pretty wild.
Chronic pain, insomnia.
Like a Swiss Army knife of medications.
Yeah, it is. And then there are the warnings.
Right.
The black box warning with fluvoxamine.
Yeah.
Teratogenic potential of paroxetine and sertraline.
Right. So, I mean, it just shows how important it is to really be aware of these potential risks and talk to your doctor about them.
Yeah, definitely.
There's no one size fits all when it comes to medication.
Yeah. So I guess for you, the listener, I mean, thinking about all these medications that we talked about and the different ways they work, from kind of tweaking the neurotransmitter levels to actually blocking certain receptors.
Right.
What does this tell you about the complexity of treating all these different health conditions.
No, it's mind-boggling, isn't it? I mean, it really makes you appreciate the incredible work that scientists and doctors do to try and figure all this stuff out.
Yeah, and how important it is to have personalized approaches to medication.
Absolutely.
Working with a knowledgeable healthcare professional.
Right. There's no magic bullet.
Yeah.
What works for one person might not work for another.
Right.
So it's about finding the right fit.
Yeah, it really is.